Jumping right into what lifestyle medicine means and how that may look differently for each of us. Dr. Caitlin Newman from Verity Primary Medicine and Lifestyle is here. So welcome to studio. We're happy you're here.
Thank you. I'm honored to be here. Thanks for inviting me.
Yeah, now I do want to start off. I know you're a North Carolina native, so how is the hometown? How are you doing just with Hurricane Helene and everything?
Yeah, I know we planned this before this disaster impacted my home state, so I'm thankful that my family's far enough east where no major impacts have happened, but we do have several friends and loved ones in the area we've reached out to intermittently, and so far everyone seems to be okay. Thanks for asking.
Yeah, no, that is amazing to hear. And with natural disasters, you know, far and wide, but obviously right in our backyards right now, it's important to know to take care of our bodies so we can help others. So we invited you here to talk a little bit more about lifestyle medicine. What is that really in the sect of health and wellness?
Yes, so in the big scheme of things, the American Board of Lifestyle Medicine has multiple pillars that are evidence-based, so we can educate our patients and empower them to take their health in their own hands and do a lot of things like have a plant-based diet, so whole food plant-based diet, active lifestyle with physical activity, a good sleep schedule, mental health, wellness, social experiences with their community, with their friends, and how all of that impacts their overall well-being and health in a holistic way.
Wow. Well, all of that truly seems like a full-time job. I feel like to maintain, as well as like going to work, having kids, but it's so important, right? Because the benefits, you just become 10 times more of a productive human.
Yes, I agree. So there's a lot of aspects you can do. You can pick and choose what you feel like is most appropriate for your lifestyle, and I always love to meet my patients where they're at to see where we can start to make improvements over time that are sustainable, because we don't like to think of this as a fad. It really is a lifestyle to promote health and a good quality of life for the longest amount of time.
Right, and all over the upstate you host really educating seminars where you get to field some questions. What are some of those big topics you cover there?
So a lot of it is, how can I do this? How is this affordable? How can I make this sustainable? So thinking of diet, lifestyle impacts with a whole food plant-based diet, I know right now it's going to be a little difficult for some people who are without power or are financially in limbo while the storm disaster relief's coming about. But for those who are in a good spot to make this change, getting seasonal local produce is a good idea. I have some here, so apples obviously are a really good idea. Carrots, celery, some greens like broccoli, kale are really big this time of year, and some citrus fruits. And don't be afraid to buy frozen if you find that financially better for you. They pick it at a ripe time for each of the fruits, and usually it's financially good. So that's one way to start incorporating at least 4 to 6 as a minimum to boost your immune response as we go into cold and flu season. 10 for an even better response. And then on top of that, I encourage physical activity. Even just regular moderate intensity things like walking every day can be helpful to boost your immune response, and that can be to prevent infection as well as preventing or boosting your immune response after you get something like a seasonal flu or a pneumonia vaccine.
Sure, and hey, vigorous walking, I'm sure picking up trees, cleaning out brush, that's going to be a big one right now.
That's going to be some pretty good labor and physical activity for those who are doing that. And we thank all our community members who are volunteering their time to do that for their neighbors and loved ones.
Absolutely. So true, Dr. Newman. And you mentioned, you might not find these in surplus in the store right now, but, when it does start to, trickle back in, these are some really good ones to look for. So great advice there. And you mentioned sleep. I don't want that one to go under the radar, because I feel, as you get older, sleep becomes more difficult. What do you have some advice for maybe some of our viewers who struggle to sleep at night?
This is a tough one, because people struggle with sleep for so many different reasons, and I have this chief complaint comes into office all the time. So trying to make it dark, quiet, cool as much as you can, and trying to do physical activity during the day, trying to avoid triggers for poor sleep, so avoiding caffeine a certain amount of time and maybe getting your heart rate up too much a certain time before bedtime is a general blanket statement that a lot of patients can incorporate to try and improve their sleep. And if you do have any other concerns, definitely talk to your doctor about it.
1000%. Yeah, I know that I was going to bed much earlier over the weekend without power. It just was dark. So it is a nice way to kind of trick yourself into sleep. And luckily, we're going to have a little bit more sunshine this week, and that's something that really is going to help you overall.
Absolutely, yeah. So another question that I get asked about about this time of year, especially as we move into shorter days, cooler weather. People aren't outside as much. As how do I get a good vitamin D level? It's super common to be low, or at least people would like to know what their levels are.
Sure.
So getting 5 to 15 minutes of sunshine every day when you can help boost those levels. And I would be remiss if I didn't mention using sunscreen to avoid skin cancer or other harmful effects, and that should not decrease your level of absorption. And then if you do want to incorporate any foods, then mushrooms are a really good source of vitamin D as well, if you like mushrooms.
Right. Well, there you go. Well, if it's a dark day, you know, put some mushrooms in the eggs. And you're actually wearing sunscreen. We were talking about this earlier. You have it on right now.
Yes.
So you are truly a method of your own practice. I love it. Well, honestly, I want you to be my doctor. Even just the way you speak is so melodic and therapeutic. I learned a lot today. Hope you guys did at home as well. And thank you so much for guiding us through that.
Thanks for having me.
Of course.
See me at Verity anytime.
Okay, perfect. Thanks, Dr. Newman. All right, well, soak up some sunshine today, whether you're doing yard work, helping out a neighbor, and you can join in on the conversation. Dr. Newman's next Health and Wellness seminar, too. We're going to post all that information online after the show, but also on your screen right here.